Hello, and welcome to the Red Hill In Focus webinar series. My name is Matt Cohen. I am a Red Hill project coordinator with EPA. On behalf of EPA, I'd like to thank you all for being here this evening. This webinar is part of the Red Hill In Focus webinar series. EPA hosts these webinars to provide information to the public about the status of the efforts to address the impacts to human health and the environment from the Red Hill bulk fuel storage facility releases. The webinar information is available on EPA's website, and you can access it by following the link at the bottom of the screen. Next slide, please. Now I'll quickly go over the functions of the virtual meeting platform we're using for tonight's webinar. If you click on the audio settings icon at the bottom of your screen, you'll be able to select or change your audio source. That's the yellow circle there. If you're experiencing any audio issues, please use the dial-in number included in your registration email. You can submit questions throughout the webinar in the question and answer box. You should see the Q&A icon at the bottom of the screen. That's the one circled in red there. Feel free to submit your questions as they arise during the presentations. A member of the webinar team may respond to your questions right there in the chat box, or if you have a more complex question, it will be asked to our panel for verbal response during the Q&A portion at the end of the call. Just a reminder, today's webinar is about drinking water, so we ask that you please try to keep your questions within the scope of today's session. Next slide, please. Today's webinar will cover monitoring of the Joint Base Pearl Harbor-Hickam drinking water system and the related health impacts. As you may already know, the Navy has been collecting water samples from the drinking water system under the long-term monitoring program. That recently ended, and the regulatory agencies are working together and are close to agreeing to the next phase of water system monitoring called extended drinking water monitoring, or EDWM. And actually that phase of monitoring is ongoing while the details are being worked out. The final details are being worked out. After I'm finished providing the introduction, Commander Dunn with the Navy Closure Task Force will present findings from their 2-year-long long-term monitoring program and provide an overview of the new Extended Drinking Water Monitoring Program, or EDWM. EPA will then provide updates on our oversight of an independent evaluation of the Navy's drinking water system. That'll be followed by ATSDR, who will provide updates on the Red Hill public health activities. We will then have time for questions. And with that, I'll turn it over to Commander Dunn. Commander Dunn.
I think you're on mute, Commander Dunn.
Can you hear me now?
Yes.
Okay, I think we had a double control there. All right, apologies for that. I'll start over. Hello, good afternoon, good evening, everyone. I'm Commander Ben Dunn. I'm the Deputy for Environment and Remediation at the Navy Closure Task Force, Red Hill. Today, I'm joined by Dr. and Captain Patrick Hennessy, the Director of Public Health at Pearl Harbor, who will be presenting on some public health information, as well as one of our technical experts, Mr. Chris Waldron of Pioneer Technologies, to assist with the question and answer portion of the webinar. Today, I'll provide an overview of the Navy's enhanced drinking water monitoring efforts conducted at Joint Base Pearl Harbor-Hickam in the wake of the 2021 fuel spill at the Red Hill bulk fuel storage facility. Next slide, so the agenda. I will cover specifically an overview of the drinking water management for Joint Base Pearl Harbor-Hickam, our drinking water long-term monitoring plan, which recently concluded and has subsequently been followed by our extended drinking water monitoring plan, as well as the Navy's Water Quality Action Team services. And Captain Hennessy will cover some information about the Red Hill Clinic. So next slide. Next slide, please. Thank you. As an overview, the Navy remains committed to the safety and well-being of those served by the Joint Base Pearl Harbor-Hickam water distribution system. As such, we apply a multi-pillared approach to ensure safe and compliant drinking water. These pillars include enhanced drinking water monitoring, first through our long-term monitoring plan, and now the extended drinking water monitoring. Routine baseline safe drinking water act, sampling and monitoring. And in parallel to our extended drinking water monitoring plan, we operate an independent but concurrent water quality response team capability. And then we also conduct our normal utility, water utility operations and maintenance, and provide some public health efforts and resources related to Red Hill concerns. Next slide. There's an overview of our long-term monitoring, or LTM program. This was a program that was established after the flushing of all of the zones on the Joint Base Pearl Harbor-Hickam drinking water system, and subsequent certification by the Hawaii Department of Health. Back one slide, please. This was a 2-year, 24-month program that ran 7 distinct periods from March 2022 to March 2024. It was established by the Interagency Drinking Water Systems Team, which is comprised of officials from the EPA, Hawaii Department of Health, and multiple officials from the Navy and Army. And the plan, as performed, was overseen by officials from the EPA and the Department of Health. Samples collected during this plan were ran for analysis of typical drinking water analytes, and more specifically fuel-related products and petroleum hydrocarbons, all via established EPA methods. Reports were regularly provided after each period to both regulators for review with the Navy. The plan consisted of 19 drinking water zones of all places served by the Joint Base Pearl Harbor-Hickam water distribution system, and there were a planned 7,800 samples to be collected from approximately 2/3 of residences served by the system, as well as all schools, child development centers, and child development homes and clinics across the distribution system through fire hydrants and at our source well, the Waiava well, which is located 6 miles from Red Hill and has served as the sole drinking water source for Joint Base Pearl Harbor-Hickam for the last 2.5 years. All samples collected during the program were analyzed and data validated and reported by a third-party contract. Next slide. During the plan and continuing today, we ran drinking water information booths across the neighborhoods served by the distribution system to provide resources, information, and education about the long-term monitoring program and today's extended drinking water monitoring plan. We run these on a bi-weekly basis. We have a few coming up in the near future. Later this week at the Halsey Terrace Community Center, and then the second Wednesday of July, we'll be at the Capilina Beach Homes Night Market. All of the results collected during the long-term monitoring plan were reported and shared publicly online on our Safe Waters webpage, to the drinking water page, and an interactive map where you can query the results by zone, by analyte, by period, and so forth. A percentage of the samples collected under this plan were collected and analyzed by the EPA for independent and comparative analysis. And in addition to the 7,800 estimated samples collected, we actually totaled 9,200 samples, all validated and well exceeding the initial planned amount And those again represent schools, residences across the distribution system, and clinics, and our drinking water source at Wyova Well. Through the entire program, we've had no detections of JP5 and no history of detections of JP5 in the drinking water since the 2021 incident, or detections of petroleum-related compounds. During the course of the program, the Navy also conducted a root cause analysis of petroleum hydrocarbons, which were reported from our laboratory, in which we learned much more about our laboratory and analytical methods. We also supported independent evaluation by the EPA and an independent investigation by the Hawaii Health, which was conducted back in February, in which approximately 15 samples were collected from our drinking water source, schools, and residences, and reported. Those findings were shared late last month by the Hawaii Department of Health, in which they concluded no petroleum or JP5 was detected in the drinking water from that sample pool either. Next slide. I'll give you an overview of the extended drinking water monitoring program, which we began in April of this year, now approximately 2.5 months into the program. It's a voluntary 12-month program that delivers on the Navy's commitment to extend enhanced drinking water monitoring for an additional year of the Joint Base Pearl Harbor-Hickam distribution system. This plan is developed by the Navy in coordination with EPA and DOH for execution and partnership with the regulators. The objectives of the plan continues our enhanced drinking water monitoring to ensure no impact of the Red Pill 2020 release exists in the distribution system today. Another objective of the plan is to collect samples from 100% of the residences served by the Joint Base distribution system, which is approximately 3,500, over 3,000 homes not collected during the long-term monitoring program. Some aspects of the plan include additional sampling zone, which is the Manana housing, which was not included in the long-term monitoring. The additional analysis of fuel-related compounds of all drinking water samples collected during the plan. Increased frequency of sampling of our drinking water source at Wyova Well, as well as every school, child development center, and home served by the distribution system on a monthly basis. We've implemented improved extraction method prior to analysis by the same EPA method for petroleum hydrocarbon analysis, so to obtain comparative data with our long-term monitoring program, and conduct advanced analysis or forensic methods to further evaluate the chemical makeup of the drinking water samples. Results, again, are available online today at our Safe Waters website on the drinking water webpage. And these are also documented in quarterly reports, which are submitted to the regulators. The plan itself is currently available on the drinking water webpage of our Safe Waters website. Again, that's the extended drinking water monitoring program. Next slide. So this is our water quality action team. This is a service that we implemented in conjunction with the start of our extended drinking water monitoring program. It's a complementary plan, but an independent program that investigates individual concerns reported to the Navy. It's a robust response capability, which stems from an expansion of the Navy's rapid response team, which we had employed throughout the long-term monitoring program to conduct screening of petroleum hydrocarbons for concerned residences. The services have been expanded to include additional resident engagement, continue to conduct house calls with concerned residents who contact the Navy, continue providing rapid screening of petroleum hydrocarbons, will offer bottled water to those residences, then also have added a water quality investigator, a professional environmental engineer, and additional trades personnel to support evaluation of the premise where the concern lies. and that is to provide a comprehensive evaluation of the premise and the home from which the general water quality concern lies. And that's any kind of water quality concern. Does not have to be fuel related, be it odor, color, or any other attribute of the water. We've been running this program for over 2 months now and continue to take concerns through our call center and respond accordingly. We've had approximately 20 house calls to date over the last few months to provide that responsive, provide that resident response and additional information and education. All of these programs serve the Navy to demonstrate that the water continues to meet state and federal standards and is safe for consumption. I'll pause there and hand it back over to the EPA. Additional information, excuse me. We have some websites here for additional information and resources for data, for contact information and other. And that includes our Safe Waters website. That includes the Navy Closure Task Force Red Hill and the Navy Region Hawaii and Joint Base Pearl Harbor-Hickam websites. That concludes my presentation. Thank you.
Thank you, Commander Dunn. Hello, my name is Claudia Espinoza. I'm an environmental engineer in EPA Region 9's Drinking Water section. Today, my colleague Chris Chen and I will be going over EPA's drinking water oversight and investigation activities for the Red Hill drinking water systems. Next slide, please. As an overview of EPA's oversight activities, EPA is providing regulatory oversight under the 2013 Administrative Consent Order, including Navy's compliance with long-term monitoring that concluded in March 2024. EPA also provided comments to the Navy's draft Extended Drinking Water Monitoring Plan that began sampling in April 2024, specifically the drafts that were submitted to us on March 15th, May 3rd, and we are currently in review of the drafts submitted to us on June 13th. EPA began split sampling and analysis for selected sites under EDWM to enhance oversight. In addition, EPA conducted independent drinking water investigations and continues to investigate drinking water complaints reported to the agency. Now we'll pass it on to Chris to go over EPA's investigations in greater details. Next slide, please.
Hello, everyone. My name is Chris Chen, and I'm a drinking water inspector for EPA Region 9's Enforcement and Compliance Assurance Division. I'll be describing EPA's investigations into the drinking water served by Joint Base Pearl Harbor-Hickam and the Aliamanu Military Reservation. Here's a timeline laying out each investigation, of which I'll describe in more detail in the subsequent slides. Our first in-depth investigation occurred before EPA's consent order was issued on June 2nd, 2023. EPA's National Enforcement Investigation Center conducted a public water system inspection of Joint Base and AMR from April 4th to 8th of 2022. EPA received a batch of complaints regarding the drinking water served by Joint Base during the week of October 16, 2023, which was also the same week that the fueling began. I conducted in-person interviews with residents on October 19th to determine the extent of the drinking water concerns and Navy's complaint response procedures. After EPA received an additional batch of complaints in February of 2024, I conducted a mix of in-person and phone interviews with affected residents from February 14th to the 16th of 2024. In addition to the interviews, after the second batch of complaints, EPA also requested Navy send split samples for any samples collected as a result of a residential complaint to EPA for independent analysis. These samples were analyzed by EPA Region 8's laboratory. From February 27th to March 13th of 2024, we received 20 split samples collected in alignment with the Drinking Water Long-Term Monitoring Plan. On April 22nd of 2024, EPA Region 9's laboratory started analyzing split samples collected as a part of Navy's EDWM plan, which was drafted at the time. And most recently, during the week of 3rd, I conducted another public water system inspection of Joint Base Pearl Harbor and AMR. And this inspection was conducted with support from ERG, who is a contractor for EPA. Next slide, please. As mentioned before, these inspections were conducted by NEIC with EPA Region 9 inspectors present as well. A little bit of background, NEIC is the Environmental Forensics Center for EPA's enforcement programs, and they support complex criminal and civil enforcement investigations. NEIC's April 2022 inspection identified numerous areas of concern, of which many were incorporated into the 2023 consent order to ensure that the concerns were appropriately addressed. The list on this slide is not comprehensive, but includes some of the concerns with Joint Base that were addressed within the order, including a lack of standard operating procedures for the operators, exercising program, flushing program, and written complaint procedures. They also noted the improper storage of chemicals used for the drinking water treatment and deficiencies with the system's risk and resiliency assessment and emergency response plan. Next slide. On October 19th, 2023, I interviewed 5 residents who expressed concerns with their drinking water. Common theme among the residents was that they all described some manifestation of skin irritation associated with bathing. As a result of the investigation, EPA coordinated with the Hawaii Department of Health and Navy collected long-term monitoring samples at 4 of the 5 homes. 3 of the 4 homes sampled had TPH detections within the 50 to 70 parts per billion range. The report included the following recommendations: provide training to Navy reps visiting homes, develop a 1-page pamphlet with the most important information, investigate the premise plumbing and the root cause of TPH sheen and symptoms, and lastly, to provide alternative water to homes while waiting for sample results or any pending investigation. Next slide. From February 14th to the 16th of 2024, I interviewed 8 residents from Joint Base and 5 residents from AMR. Of the 13, I spoke with 8 in person and 5 over the phone. Similar to October 2023, a common theme was residents describing skin irritation of some sort, as 10 of the 13 residents reported skin irritation within the past 2 months that they perceived was linked to contact with the water. 10 of the 13 residents also reported relying on alternative water for drinking. The February investigation also confirmed that Navy had attempted to address all of the previous reports recommendations from the October 2024 investigation. In addition, the February investigation yielded the following recommendations. The first was to incorporate sheen analysis when responding to complaints if sheen is observed. The development of an outreach plan, so residents are aware of any protections in place from retaliation or reprisal when filing drinking water complaints. And to develop standard operating procedures for managing the alternative water and when it should be delivered. Next slide. Lastly, I recently conducted a public water system inspection with support from one of EPA's contractors, as I mentioned earlier, ERG. In addition to EPA's routine focus during our water system inspection on the physical assets, operations, and maintenance to determine their compliance with the Safe Drinking Water Act. These inspections also had an extensive sampling component. We collected samples for a subset of the analytes within the EDWM list, including EDB, TPH, some priority volatile and semi-volatile organic compounds, and metals such as lead and copper. These samples were collected at Waiava Shaft, Red Hill Shaft, Aya Halava Shaft, 5 homes, 3 childcare facilities, and AMR's entry point to the distribution system. For those who may not know, the entry point is the sampling location after all treatment and is considered representative of the water served to consumers. In addition to the analytes from EDWM, we additionally collected PFAS samples at the 3 sources and AMR's entry point. These samples will be analyzed for over 70 different PFAS analytes so that we have as much information as possible regarding any potential PFAS presence. These inspection reports are still in development, and I can't comment on any observations or areas of concern from the inspections at this time. But when the Joint Base report is finalized, it will be available on EPA's Red Hill website, where you can find EPA's previous reports as well. We have the link available on EPA's last slide for quick reference. I'll pass it back over to Claudia now. Thank you for your time.
Thank you, Chris. During long-term monitoring, as a follow-up to resident drinking water complaints, EPA conducted independent laboratory analysis of 20 split samples at residents with drinking water complaints. These split samples were collected by the Navy and were sent to EPA Region 8 certified laboratory in Lakewood, Colorado. To provide a brief overview of what split sampling it is a technique where multiple samples are collected from the same location at the same time and then sent to separate laboratories for analysis. The results from the separate laboratories can then be compared to help determine the accuracy of the data. Next slide, please. So how did the EPA long-term monitoring split samples compare to the Navy's results? I first want to point out that EPA and the Navy had different laboratory method detection limits, as well as different method reporting limits. The MDL and MRL from EPA Region 8's lab was much lower than that of the Navy's. Therefore, there was a notable difference in the number of TPH detects and non-detects. The TPH concentrations in the diesel range was 20.5 through 28.8 parts per billion from EPA's R8 lab, and non-detect through 51.6 ppb in the Navy's lab. And both were non-detect for TPH concentrations in the gasoline range. EPA also conducted chromatogram pattern analysis of the TPH detections that were found. The pattern detected did not resemble JP5 or other fuel analytes, and the low-level TPH detections were likely attributed to a residual chlorine surrogate reaction. Next slide, please. Now that LTM has concluded and the Navy has begun tested under EDWM, EPA is committed to continuing to perform independent split sampling analysis on a selection of drinking water samples collected by the Navy under EDWM. These split samples collected by the Navy under EDWM are being sent to EPA Region 9's certified laboratory in Corvallis, Oregon for independent analysis. Next slide, please. EPA began laboratory analysis of the EDWM split samples on April 22nd, 2024. EPA is analyzing for most of the contaminants listed in the Navy's EDWM plan. In the table to the right, you can see some of the notable analytes from this analysis, including total organic carbons, total petroleum hydrocarbons in the gasoline, diesel, and oil ranges, ethylene dibromide, semi-volatile organic compounds, volatile organic compounds, metals and mercury, anions, cations, silica, and total alkalinity. The results of this analysis will be available in an independent EPA dashboard that is currently under development. More information on this dashboard will be communicated in the future. Next slide, please. This concludes EPA's portion of today's drinking water webinar. For a copy of EPA's final drinking water investigation reports, as discussed earlier in the presentation, please visit the website linked on the screen. In addition, for additional information on the entire work that the EPA is doing to regulate the Red Hill bulk fuel storage facility, please visit epa.gov/red-hill. And if you have any questions about EPA's work on Red Hill, please submit your questions via email to redhill@epa.gov. Now I'm going to pass it on over to Captain Hennessy from the Navy Health to discuss health impacts. Thank you.
Good evening. I'm Captain Hennessy, MD, PhD, specializing occupational and environmental medicine, and also the public health emergency officer associated with the commander of Navy Region Hawaii. Starting on the 28th of November 2021, when the early reports of smells of fuel and taste of fuel in the water occurred and the Red Hill shaft water was turned off. The next morning, Navy medicine and the military health system started to see some patients who were reporting symptoms they associated with fuel exposures. Very quickly, within the next week, we stood up pop-up clinics at Halsey Terrace, the Emergency Family Advocacy Assistance Center, AMR, and the Ohana Clinic at Makalapa Clinic to treat these individuals. Over the next month and a half, we saw approximately 400 individuals through all of these clinics and then fixed health centers around the island, including Campsie and Desmond Doss. They've been quieted down significantly, and we started towards the middle of 2021 seeing maybe 4 or 5 patients a month reporting symptoms they were associated with water exposure. Around November of 2021, we started to see an uptick in complaints of lack of access to medical care on Facebook and other social media sites, but that was not reflected in what our clinicians were telling us. Because of that, we started planning for the Red Hill Clinic, which opened on January 3rd of 2022, specifically to give quick access to individuals who felt they were being affected by the water. Initially, we had 3 primary care, family medicine type providers, and on-scene specialty care, including dermatology, gastroenterology, neurology, and psychology to assist. And so people who came to the clinic could immediately be seen same day by specialists to address their skin rashes, headaches, neurologic symptoms, and GI complaints. Over the course of this, starting in March of 2022, the Secretary of Defense created a special class of individuals called the SecDes, or Secretary Designation individuals, who lived in housing that was supplied by Navy water distribution system, but were not affiliated with the DoD. This primarily was Capilina Homes and Iroquois Point. They were allowed access onto base to be seen at the Makalapa Clinic, and if appropriately screened and determined to need specialty care, they could then get the specialty care through the military health system. In the 16 months that the Red Hill Clinic's been open and the 13 months that the SecDes status has existed, there's been a total of 293 individuals seen through the Red Hill Clinic and 12 Secretary Designation individuals. The Red Hill Clinic initially started with 2 days a week clinic. It then slipped to 2 days a week, but mornings on Tuesdays and afternoons on Thursdays because of underutilization. The specialists were returned to TAMC, but we maintained same-day access to them. It just wasn't on site because it wasn't cost efficient, and they were underutilized. Subsequently, again, with continued decreased utilization, the clinic went to 1 day a week. It typically has 4 to 8 appointment slots available, but can accordion as needed. And over the last 2 months, they have gone largely unutilized, less than 50% capacity. So essentially, despite the reports in social media and on the news, once we provided easy, free access, basically, to medical care, it still was underutilized by the population. Recently, the BUMED has authorized the release of several epidemiologic reports that were looking at symptomology amongst our population 12 months prior to the spills and 12 months after the spills. And what these studies showed is what we saw clinically, namely the starting around the 25th, 26th of November, there was an uptick in symptoms associated with JP5 exposure, primarily headaches, confusion, nausea, diarrhea, and skin rashes. This was a small uptick accounting for about 250 people. And by the end of December of 2021, that number had returned to the baseline and has stayed at the baseline level of these symptoms ever since. Now, when I say baseline, what I mean is all of these specialists, the dermatologists, neurologists, gastroenterologists, existed before the Red Hill spill occurred. There are, just at a baseline in the US population, a certain rate of rashes occurring. The actual rate is 14% of American adults have a rash significant enough to report to medical every single year. So just looking at the 28,000 individuals who live in residences supplied by Navy housing, you would expect about 4,000 rashes to be reported to medical. Through the Red Hill Clinic, we saw 69 during this 1 year period. So in essence, what the studies are showing us is that there was an uptick in symptomology associated with JP5 immediately after the spill. As soon as the Red Hill shaft was shut down, what our sampling shows is that the detectable contamination within the water supply and distribution system was within regulatory requirements. And by the end of that month, as the dilution occurred, we no longer saw increased symptomologies. Now, yes, we do continue to see diseases occur, but most of them have been at the rate that we would expect normally. Some of them are totally devastating diseases, and I'm very happy is the wrong word, but I'm very satisfied that people are seeking medical care and getting diagnosed and then getting the appropriate medical care. The fact is, though, that most of these diseases are not and probably could not be caused by JP5 exposure. For long-term health effects, the DHA is establishing a third-party registry as requested by the ATSDR second survey or recommended by them. This will be run by one of the local universities. There should be an announcement. I'm not going to make it tonight, but the university should be announcing within the next week or so the size and scope of what they're planning and what they'll create in the long-term registry. Unlike the initial incident report, also known as the DOORS registry, where all of the residents were entered automatically into the registry if they lived in housing supplied by the water at the time of the spill, and then subsequently all of the employees working on Joint Base Pearl Harbor in that same time frame were added to the registry as an occupational exposure. The long-term registry, third-party registry, will be voluntary. Announcements will go out, advertisements will be made. It will be very publicly sourced. But if you feel that you've been exposed and or your health is affected by Red Hill water, you can voluntarily enter yourself into the registry. Now, as opposed to the DOORS incident report, this registry will require some interaction from you, such as they may have annual surveys as to what your health status is. They may ask specific questions. If they see a symptomology that's common, they may say, hey, are you experiencing this? But all of that will be run by a third party, and I'm not going to get into their wheelhouse. Pending any question. Oh, sorry. We've also had reports of complaints regarding the Red Hill Clinic. Now, Red Hill Clinic, as I said, has not turned anybody away because of lack of an appointment. If there was a full day, they can expand and start being seen by primary care doctors who have received training on the Red Hill situation. Through our official the ICE system, which is the Interactive Customer Evaluation System that you've seen if you go to one of our clinics, We have a special QR code that for anybody who's in the Red Hill Clinic, it's posted right at the front, very prominently. They can take the QR code and they can make comments about the Red Hill Clinic. We have to date received no comments through the ICE system, either positive or negative. Any questions at the end of this? That's all I have.
Hi, everyone. I'm Ben Gerhardstein with the Agency for Toxic Substances and Disease Registry. And I think there's a previous slide to this one. Nope. All right, well, we'll kick it off with that one that was there previously. So I work in our Region 9 office, ATSDR's Region 9 office in San Francisco. For those that aren't aware, ATSDR is a non-regulatory federal public health agency that is part of the Centers for Disease Control and Prevention based in Atlanta, Georgia. We have a variety of programs that respond to environmental health emergencies, investigate health concerns at contaminated sites, and support our state and local partners. I'm here tonight to give a short overview and update on ATSDR's public health work at Red Hill. And I'll start by acknowledging just how concerning the Joint Base Pearl Harbor-Hickam water system contamination has been for many affected service members, their families, and civilians. And ATSDR is committed to working with other agencies and engaging community members as we investigate Red Hill health concerns and work to protect public health. Next slide. Or sorry, actually not next. This is my next slide. So soon after the November 21 release, the Hawaii Department of Health asked CDC ATSDR for support in several areas. While our initial involvement in the response included other activities, we have 3 current work streams. So first, investigations into Red Hill health impacts through 2 assessment of chemical exposures, or ACE, investigations with the Hawaii Department of Health, and 1 with the Department of Defense Health Agency. Second, public health assessment activities to evaluate whether Red Hill releases since 2005 have harmed people's health, again at the request of the Hawaii Department of Health. And then third, various kinds of technical assistance that we provided to the Hawaii Department of Health, the Defense Health Agency, and EPA. In this presentation, I'm going to briefly describe each of these activities and point you to resources where you can learn more. Next slide. ATSDR has conducted 3 ACE investigations to assess the potential health effects of the November 21 jet fuel release into the Navy water system. We conducted the first ACE investigation in early 2022 at the request of the Hawaii Department of Health. In that investigation, we used an online health survey to ask civilians and military personnel about their exposures to the contaminated water, health symptoms they experienced, and medical care they sought. Findings from that initial ACE investigation were published in a journal article and the Hawaii Department of Health fact sheet, both of which are linked from ATSDR's Red Hill website. Then, about 6 months later, in 2022, again at the request of Hawaii Department of Health, we conducted a follow-up ACE investigation to assess ongoing community concerns and health impacts. Hawaii Department of Health summarized those preliminary findings from the follow-up ACE in a fact sheet that you can find on their Red Hill website and linked from ours. And CDC ATSDR is preparing a manuscript with final results for publication that will include both that initial ACE and the follow-up ACE investigation results. ATSDR conducted a third ACE investigation in early 2023 at the request of the Defense Health Agency. This investigation examined military health records to assess the incident's health effects on military personnel. CDC ATSDR is developing a journal manuscript with this third investigation result with the investigation's results currently. And once the 2 journal articles that I just mentioned that are in process are published, we'll be updating our Red Hill web pages with links. Next slide. ATSDR's Red Hill focused public health assessment activities are our second work stream. This project will help to better characterize and understand possible exposures and health risks from chemical releases that have occurred at Red Hill since 2005. Our goal is to determine whether and how exposures to chemicals released from Red Hill could harm people's health. And we've gathered and begun organizing available drinking water sampling data collected by the Navy and the Hawaii Department of Health. And we're going to use those environmental data along with health data and information about the design and operation of the Joint Base Pearl Harbor-Hickam water system in determining whether exposures could harm people's health. I should point out that we'll likely find data gaps that will limit our ability to draw health conclusions. But based on the findings, we will be making recommendations to protect public health. We're still relatively early in the health assessment process, which can take several years. And if you want to receive email updates about ATSDR's public health assessment activities at Red Hill, please email my colleague, Jamie Raymond, at jrayman@cdc.gov. We are committed to engaging current and former residents throughout this health assessment process. Next slide. Since I have time today to give only a quick overview of ATSDR's work, I thought I would note that we provided a more in-depth presentation with results from the initial and follow-up ACE investigations and a more detailed explanation of Red Hill public health assessment activities during EPA's January 2023 Red Hill in Focus webinar. So there's a recording of that webinar on EPA's website, which you can go check out. Next slide. In addition to our ACE investigations and public health assessment activities, ATSDR has provided technical assistance to several partner agencies. We conducted a technical review of Hawaii Department of Health's exposure assessment report on the November 21 release of JP5 into the Navy water system. We've been providing advice to the Defense Health Agency regarding the establishment of an independent Red Hill Registry for people affected by the November 2021 water system contamination. This is what Captain Hennessy was speaking to. And we're also assisting EPA in developing a risk assessment framework to address ongoing drinking water concerns. Next slide. You can learn more about ATSDR's Red Hill work by visiting our Red Hill website, which I've mentioned a couple times. The URL is atsdr.cdc.gov/sites/red-hill. Next slide. Finally, here's my contact information. Please reach out if you have any questions about ATSDR's Red Hill work. My email address is bgerhardstein@cdc.gov. That's it.
All right. Thanks to all the presenters. Now we can move on to the question and answer portion of the webinar. Questions have been submitted during the in the chat box and will be asked of our panelists to provide verbal responses. This webinar today is focused on drinking water, so if your question is outside of the scope, we may not be able to get to your answer tonight, but we'll work to try to get you an answer soon. So I will start. I don't know if those are showing up. The first question is, mahalo for finally including I'm not good at pronouncing it, but especially there have been issues reported there for years. Are these families going to be included dating back to at least 2020 and 2021? Do we have a panelist to answer that?
Yeah, hi, this is Chris Waldron. So Monona Housing originally was not included in the long-term monitoring program that followed the November 2021 release. The reason for that was Monona Housing at that time was not on the Joint Base Pearl Harbor-Hickam water supply system. It was actually being provided water from the Board of Water Supply. So the system was not impacted and could not have been impacted by the release from Red Hill in November of 2021. Subsequent to that, after the emergency response phase, and when the Department of Health amended the health advisory in March of 2022, Monona Housing was subsequently switched back over to Joint Base Pearl Harbor-Hickam water supply. So when we went into the planning stages of the EDWM, one of the things we talked about was, since Monona was back on the Joint Base system, was to include Monona as part of our monitoring program. And so Monona was added as our 20th zone. We will collect EDWM samples and water quality action team samples in Monona. And in fact, we will be sampling all of the homes in Monona, all the residences, so that will be consistent in terms of percentage with all of the other zones. So, you know, in the other zones, we as part of the LTM, we collected about 65% of the homes were sampled. We're trying to get the remaining 35% of homes as part of EDWM. But in Monona, we're going to do 100% so that it's the same as the other areas.
The next question is, Capilina is over 1,400 homes plus childcare and center plus elementary school. Thought there was more to that question.
I can try to answer that, Matt. Similar answer. Capilina was included as part of the long-term monitoring program. So 65% of those homes approximately were sampled during the 2 years of long-term monitoring. As a follow-up for EDWM, we'll get the remaining 35% over the next year. In addition to that, we have been collecting samples from the elementary schools and CDCs in those areas as well, and we'll continue to do that as part of the EDWM program.
Thank you. Next question, how much bottled water do you provide to each family?
Is Commander Dan? Good. We offer approximately 2 to 3 gallons a day per person and per pet, while we collect the samples and await for the results. So per household, 2 to 3 gallons roughly per person and pet each day, while awaiting results of the samples collected.
Thank you. The next question is somewhat similar. Can you explain more about providing water? How long? I think you said while the sampling is done, but maybe you can explain how long that typically takes.
Certainly. Thank you, Matt. Thanks, Matt. So when we reach out to the resident to schedule sampling, once they contact the Navy with a concern or a request for sampling, then we offer water at that time. If the resident is interested, we then deliver it in the next 24 hours. And samples take approximately 5 to 10 days for actually about 10 days or so, 2 weeks maybe. As we rolled out the new drinking water plan, there was a period where it took longer to get the results back. So there was an extended period, but roughly today, about a week and a half, maybe 2 weeks.
Thank you. Next question. Why won't the Navy test for PFAS if there is such confidence that it's not in our drinking water? Why not humor the population that you previously poisoned and test for it?
So we do test for PFAS at our drinking water source. We collected 2 samples in 2023, and we recently collected a sample as part of the EPA inspection. We did some split sampling with them just a couple weeks ago, and we are waiting for our results from that latest round. It was non-detect for the 2023 round of sampling.
Thank you. Of the expanded data collection, are there methods that are in serious contention with CRA views of the data and this collection methods? Understand if this is more a challenging question to answer without consultations with them. I'm not sure where we're going with that question. Does anybody have
Certainly,
any?
I will respond and confirm all of the sampling and analysis that we do and have done during the long-term monitoring and currently during the extended drinking water monitoring are utilizing existing approved EPA methods with an EPA certified laboratory. And that's for 100% of the samples collected during LTM and today during the extended drinking water monitoring plan. And I'll open it to Chris if he has anything he'd like to expound further on. But
The only thing that I would add is that we've been, working in conjunction and oversight with the Department of Health and Environmental Protection Agency on method development, evaluation of the data, in conjunction with, and I think is really important, is that both DOH and the Environmental Protection Agency have collected split samples. So really, there's been a ton of work done in terms of pre-planning, actual implementation and oversight, post-result evaluation and discussion to ensure the integrity, precision, and accuracy of the data. That's been one of the things that's been, I think, a fundamental underpinning of the emergency response, the long-term monitoring response, and EDWM as we move forward. And we'll continue to do that and work with our regulatory partners to make sure that we are correctly collecting the data, which we have, as well as transparently sharing the results and communicating, what that means to the public.
Is there anything EPA wants to add about the methods being used? Hearing nothing, I'll move on. Next question. When will the incident-specific limits reduce back to their pre-spill EAL? An incident-specific parameter was part of the long-term monitoring. Is that correct?
Yes. So as part of the emergency response, Matt, the Department of Health developed an incident-specific parameter for total petroleum hydrocarbons. That number was 266 microgram per liter for total TPHs. The primary values that were used in terms of the long-term monitoring program, first and foremost, we use maximum contaminant levels, both federal to start with and then state. And then we had the incident specific parameter for TPH because that doesn't have an MCL. As part of the extended drinking water monitoring plan, we are using MCLs, both state and federal MCLs to evaluate the data. We are not using the incident specific parameter. That went away as part of the long-term monitoring program. So we're evaluating the data using a tiered approach and enhanced forensic analysis of total petroleum hydrocarbons. That's detailed in the extended drinking water monitoring plan that's posted on the Safe Waters website.
Next question. Have the recommendations from the previous investigations, such as sheen analysis, been implemented as SOPs for responding to complaints going forward?
Yes, so EPA had communicated that after the October investigation that they conducted. We have since included that specifically in our response measures, and then specifically within the water quality action team that we deploy and respond to concerns today. So we have a standard to evaluate that, ensure that there's a clear and deliberate approach to seeking any observations of sheens in the water that's evaluated and samples collected during that process.
Next question. For the next phase of monitoring, what will the sampling protocol be, including the timing of when samples would be tested? And it says see previous question, but I'm not sure which previous question that's referring to.
So samples during the extended drinking water monitoring program, they're collected daily on workday, so Monday through Friday. We are scheduling and collecting samples from the residences or from the distribution system, the hydrants, the schools, the CDCs, and the well every month. And those are sent off within 24 hours, typically within the same day. Results process over a 2-week turnaround. We post the results for the school CDCs and the source water well as soon as we have that data. So that's typically up on the Safe Waters website now within about the third week of the month. And then the remaining data collected from the previous month is posted by the end of that following month. So everything collected during May, we look to have posted online by the end of June on the Safe Waters website on that dashboard.
Yeah. Have you received regulatory concurrence, DOH and EPA, with the sampling process you described in your tech memo? Note if the sampling plan is different from DOH recommendations in their separate investigation.
Sorry, issue with the button there. I'll speak briefly and then I'll turn it over to Chris. So we collected all the samples that have been collected and evaluated. We've done split samples between the Navy and EPA and or DOH. You know, the recent report, as I highlighted in the brief from DOH, found no petroleum in the water. That is what we have determined as well. And as far as the current sampling and analysis plan, again, the Navy had developed that, but that has been in close coordination and in continued dialogue with both DOH and the EPA. Chris, anything further you'd like to offer?
Yeah, I would say all the work that was done was done, you know, in concurrence, because that was part of the interagency drinking water systems team. And that sampling analysis plan was developed by that team. As we move forward into EDWM, and I think, you know, EPA obviously you can speak for yourselves, Matt, and the folks that are online. But in the dialogue that we've had general agreement in the overall approach, and even more so than that, from my perspective, we're still working out some of those details. But the fundamentals of what we're doing, number of samples we're collecting, and how we're analyzing those samples, I believe we're in agreement. We've got some little things that we're still trying to work out, but overall we've been on the same page. But that's because we've done a lot of hard work together, and that work started in at the end of January of this year, where we were having daily calls, daily meetings, in order to try to move this forward and make sure there wasn't a gap between the end of long-term monitoring and the beginning of the extended drinking water monitoring. So I think that, the way that I would characterize it is that we're much more aligned and much more closer together, if you will, than we are further apart. And I'm hoping to see that that'll continue as we move forward.
You. The next question, I think, applies to the EPA presentations. While all these numbers are low, some of the test differences between the EPA test and the Navy lab are a multiple of 2. Obviously, the EPA is going to continue to provide independent analysis, but will the Navy lab in the next few years adopt the best practices and standards the EPA is using?
So I can address that if you want, Commander, or if you want to jump in.
Go ahead, Chris.
So the Navy's lab is and has applied the best standard practices in terms of lab analytical methods with respect to all of the methods that are run at the lab. So as folks may be aware, we run a variety of different analytical methods, drinking water methods. So the method that's called 524, which is a volatile organic carbon method, 525, which is our synthetic organic compounds method. Those are both standard drinking water methods. In addition to that, we run an EPA method that's not a drinking water method. That's 8015. That's the TPH method. And I think that's what's being referred to here. The EPA lab in Region 8 had about some of the detection elements were about half of what we're getting in our lab, but those are extremely low. Our lab, I think the method detection limit's about 50 micrograms per liter. EPA's was around 25-ish, could have been 22. I don't remember exactly off the top of my head, but it was in that ballpark. Those are very comparable in terms of laboratories, and so it's not an SOP issue because they're both implementing most advanced SOPs. There could be a slight difference in some of the instrumentation, but that's allowed for in the method. So it isn't a matter of the standards. The lab is doing an excellent job for the Navy. We're getting very, very low levels, and we're going to continue to do that. Over.
And I might add that I think, between labs, one might expect to see slight differences anyway. Next question. What is your plan for groundwater monitoring? And I don't know that the right people are on necessarily, but I guess the Navy continues to do groundwater monitoring. That data is provided in EPA's web app, and it's also provided in the Navy Safe Water website. So groundwater monitoring does continue as part of the environmental investigation. The next question. Good data by the doctor. I think the National symptomology literature studies are based on inferential studies. The data references for the Red Hill Pearl Harbor Clinic sound like they are assuming it is census-related data. Is that correct, or is their data extrapolated?
Not exactly clear what the question is regarding, but the data from the Red Hill Clinic is actual patients seen, the 293 individuals in the last 17 months. If there's a clarification of the question, I could answer it.
I can't see I have to keep place where I'm at, so I can't see if there's clarification below, but if anybody else who's looking at the list wants to chime in, we can do that. Hearing nothing, I'll skip to the next question. If we get something later at the bottom, we can address it then. As asked for years, what are your other carcinogens you are treating for besides JP5, since we know that it's not only the thing that we were exposed to long term? Why do you insist on only discussing JP5?
So our, as I briefly reviewed in the presentation, we have a multi-tiered approach to how we sample and monitor our drinking water system. We do run the baseline Safe Drinking Water Act compliance monitoring. The long-term monitoring and the extended drinking water monitoring plans both have a fairly extensive list of analytes that we analyze for. And the extended drinking water monitoring plan is specifically evaluating fuel-related compounds, but the long-term monitoring had a much longer list encompassing some other considerations, the metals and other analytes that are often looked for in drinking water. But the results that we've collected, again, they continue to meet state and federal standards.
And I'll just add for ATSDR that in our work assessing potential health risks related to releases from Red Hill since 2005, that we're looking at all water samples taken across a range of contaminants, not just JP5. And we'll be comparing those to health-based comparison values to determine if additional investigation is necessary.
Thank you. Next question. After reviewing our medical records and these surveys, are we now admitting or diagnosing individuals exposed for an extended period of time with chronic long-term hydrocarbon toxicity exposure?
No, because actually none of the conditions stated in the question exist. This is a acute exposure to a JP5 spill that immediately started declining and decrease in what the exposure was, and the possibility of people being exposed because they were advised not to drink the water until it was declared safe for all uses. All of the models talking about disease are extended drinking water models. The incident-specific parameters set up by DOH assumed a 6-year exposure daily to consuming and bathing in the water. The EPA drinking water standards assume a 70-year daily exposure. This at most was less than a month potential exposure. All of the samples taken from the distribution system after that time have failed to show an exceedance in any of the chemicals.
From an ASTDR, it says public health statement, total petroleum hydrocarbon states there are no medical tests that shows if you have been exposed to TPH. However, there are methods to determine if you have been exposed to some TPH compounds, fractions, or petroleum products. For example, a breakdown product of N-hexane can be measured in urine. Benzene can be measured in exhaled air, and a metabolite of benzene, phenol, can be measured in urine to show exposure to gasoline or to the TPH fraction containing benzene. Exposure to kerosene or gasoline can be determined by its smell on the breath or clothing. Methods also exist to determine if you have been exposed to other TPH compounds. For example, ethylbenzene can be measured in the blood, urine, breath, and some body tissues of exposed people. Why are these tests done? Why are these tests not done for those who came into Tripler or Red Hill Clinic or any other medical offices? If not, why not?
This is Dr. Hennessy again. Very early on, it was determined that due to the half-lives of the specific chemicals that we could potentially determine, that we would not see any positive results in that. It was also determined to treat the individuals coming in for symptoms, and we treated symptomology and diagnosed their issues that way. But that was also agreed on by the DOH in a paper they published in recommendations to providers that this broad spectrum testing is not useful in this situation.
Thank you. Next question. Nope, it disappeared on me. All right. The long-term harm and consequences are very real and still ongoing. What is the recommended medical treatment for those families?
As I've stated from the beginning, it is an individual doctor-patient encounter where the doctor speaks with the individual, takes a history, does the proper test, diagnoses the individual, treats the individual, and hopefully on follow-up, the individual has resolved the symptoms or most of the symptoms, except in the cases of, yes, there are chronic diseases that have come up. Again, not outside of numbers that we would expect in the normal population. As I also said, it's great that individuals are seeking medical care and getting appropriate treatment and diagnoses. They may not agree with the diagnosis or the cause of the diagnosis, but the treatment and care is the most important part of that process.
Question: when people call the water quality action team with health issues regarding their water, they are provided bottled water for drinking. How are they able to get alternate water for bathing? Or
So
are
we
they?
provide bottled water, alternate bottled water for drinking. The water continues to meet state, federal standards, but because the individuals are concerned, that is why the Navy provides the alternate bottled water for drinking purposes.
Thank you. Next question. As most of Hawaii's sewer and water pipes are very old, military and civilian, is there a long-term plan for a phased upgrade of the system?
So for the Joint Base drinking water utility system, there is a recapitalization plan that addresses the system as a whole. It does go in phases, and it goes, multiple years, just like most any utility. The laterals in the Navy, in the neighborhoods for Navy housing, military housing is supported by the housing entity, but there is a comprehensive plan. Repairs are done throughout the distribution system on an annual basis, and that's been ongoing for years, and it will continue to occur for years.
When the water samples were collected, was there a pattern of more contaminants than others in certain areas? And if so, is there an overlay of the contaminated sites, maybe more of the sources in one area than another?
Certainly will respond. So there is no observed pattern. The data that we did collect through the long-term monitoring plan, and also the data that we're collecting through the extended drinking water monitoring plan, are available on the Safe Waters dashboard. So you can query and visually see on the map where the samples are collected from, and to take a look at the individual results for the different zones.
I think it's important to note, I mean, the source water is all from the Wyava shaft. We've collected almost 9,000 samples during LTM. Actually, it's a little more than that if you include all the samples. The water quality is excellent, and has continued to be demonstrated through rigorous testing, as well as the independent testing performed by DOH and also sampling by EPA. So as we work forward, we haven't seen any sort of patterns of contamination, because we really haven't detected any contamination within the system. And you've really only got one potential source water well that's connected, and that's the Wyava shaft.
Next question, where are you sampling for PFAS as the military water is coming from Wyava? And then the second part, where is the EPA certified lab located? And I'm not sure if that means the EPA split sample lab, or if that means the EPA certified lab for the Navy, but maybe we can answer both.
Yeah, certainly. So the PFAS is sampled from our source water, which is the Wyava well. And the labs that we utilize for all of the drinking water analysis is done with EPA certified labs in the mainland over to EPA.
Anybody from EPA comment on where we're sending our split samples?
I think this one's specifically for PFAS. Chris, were the PFAS collected samples sent to Region 9 laboratory?
So the PFAS samples that we collected during the inspection were sent to Eurofins. Otherwise, EPA Region 9 lab is sampling for most of the EDWM analytes, and BSK lab is a subcontractor who is analyzing a smaller subset of those EDWM samples.
Thank you. Next question, the LTM water sampling data and the EDRM water sampling procedure results of sorts. Why the sampling data is not related to the location of the detections with the drinking water system, why there is not an engineering evaluation of the detections in relation to the water flow, pressure configuration, et cetera. What about clusters, abnormalities in the data, et cetera?
mute button again. So the samples that we've collected are distributed across the entire installation, across all the zones for both the long-term monitoring and the extended drinking water monitoring plan. It's the same list of analytes that are performed. The analysis performed for every single sample is consistent between all the LTM samples and then now all the extended drinking water monitoring samples. I'll pause there. I'll let Chris weigh in with any thoughts as well.
Yeah, thank you. I think it's important to note that as part of the emergency response, when we developed the 19 zones on the system, we certainly were looking at pressures, flows, system configuration, operation and maintenance information, and performing an engineering analysis. And in addition to geographic proximity, right? So when you look at the 19 different zones, you'll see the relationships of those and how we came about those. And they make sense in terms of all those things. When we, with all of the data that comes in, we're evaluating it in terms of clusters, patterns, anything that happens in terms of potential explanations, changes in water and water flow, so on and so forth. The one thing that I'd like folks to know about this system is that it's an unusual system if you compare it to other systems in the United States, for example, in the sense that this really is a system that is a continuous flow system. Other than the tanks that are up at Red Hill, the Ala Moana Military Reservation, there's really not much in the way of storage capacity. So the Waiava shaft pump has to pump nearly continuously because we don't have a storage. So the water moves through this system essentially from source to distribution point very continuously. That's a good thing because we don't have much in the way of stagnation. We have water that's flowing continuously. We sample the Waiava shaft, and so that gives us a really high confidence in the water and the overall water quality. This system pumps about 20 million gallons per day, which is a lot of water. And again, the vast majority of this water is not stored in any way, shape, or form.
Next question, is Agent Orange one of the chemicals that is known to have been an issue previously or now with any testing results?
No, I don't believe so. I'm not familiar with the chemical makeup of that material, but we don't sample specifically for that. No known record of that. But Chris, if you have any thoughts, I'll certainly allow you to articulate further.
Yeah, I'm familiar with it. No, Agent Orange and the chemicals that comprise it are not known to have been an issue at all within this facility or any of the source areas. So it hasn't been anything that's been an issue or concern with respect to the Joint Base Pearl Harbor-Hickam system.
Thank you. Our community volunteers in Capilina continue to give 5 and something gallon jugs of water to our community. Our money is about gone. Can we get help from any agency to pay for the water? And the same person says, I was not given water when the last testing was conducted in my home.
To respond to that individual's concern, I would certainly encourage you to call the Emergency Operations Center, the number that we have posted, and we can follow up with you about that and any samples collected and the support provided.
Next question. Given the several dozen lead exceedances noted in the Safe Waters website, will the extended drinking water testing include samples taken immediately after the faucet is turned on, in addition to samples taken under general sampling procedures? Do we have an answer to that one?
Yeah. Yeah, coming on. Sorry, I was checking our plan. So we do not take first draw for the extended drinking water monitoring samples, which I believe is what the resident or this individual is referring to. We flush and then we take the samples. That's the standard protocol for this plan.
Thank you. DOH stated in their report a difference of opinion. Chris, as follows: the corrective actions proposed by the Navy to account for lab error may decrease sensitivity of the detection. As such, for the purposes of continued monitoring, the Navy should be committed to include forensic techniques whenever a detection is made. And I think it's more of a statement, but will the Navy be committed to including forensic techniques whenever detection is made?
So as part of the EDWM that's posted out there, we have a tiered approach for evaluating any and all TPH detections. And we follow the procedures that are stipulated in that tiered approach using a data-driven methodology. If that leads us to tier 2 and forensics, then we run that. But that isn't necessarily run on every single sample. You have to work through the process. That process includes things such as looking at method detection limits, looking at method blanks, looking at equipment blanks, so on and so forth. But the Navy is committed and has committed to running tier 2 analysis, which are these detailed forensic samples on a minimum of 50 samples or 50 locations, regardless of whether what the detection is or not. After that, we follow a data-driven approach. I would also note that I think there was a kind of a misunderstanding and maybe it was just poor communication on my part to DOH in terms of the methodology. The sensitivity of the method, the new method that we're using under EDWM is equivalent to or better than the previous LTM method. We're using a large volume injection. And I think I admitted that the first time that I communicated this to DOH. We actually had a call earlier last week to talk about this, which basically results in improved sensitivity in the method. So we're not less sensitive, we're equivalent or more sensitive than what we were doing under the LTM program.
Next question: how long will this monitoring protocol continue? Will it continue until the soil and groundwater is cleaned up?
So the Navy's voluntary extended drinking water monitoring program is set to run for 12 months. So from April of this year to March of next year. The environmental remediation, that's outside the scope of this, but those efforts will continue beyond that timeline.
Question: were samples taken from Red Hill water well immediately following the spill in 2021 tested for PFAS? If so, was PFAS detected?
Yeah, I don't have that information in front of me. So we'll have to take that one down.
How does the Navy plan on rebuilding trust with the community and the Red Hill Clinic?
Excuse me, the Red Hill Clinic will continue for at least the next year under the Secretary designation letter that was signed out in March of this year. After that, I do not know, but we'll continue as stated, seeing any individuals who present to medical, we will evaluate them, diagnose them and treat them as appropriate. Each provider, obviously that's part of our creed, so it's what we do.
And the Navy is committed to the public and the users of the Joint Base distribution system. That's why we've implemented this extended drinking water monitoring program to further evaluate the water from a petroleum contaminant perspective, but then also to continue communication, continue on the good work that the Joint Task Force did and the DoD with defueling and all the outreach events that they have done. And so the Navy Closure Task Forces has established forums for outreach and communication, and we will be doing that for a long time to come.
Thank you. For the doctor, for the patient data, do you assume it's totally possibly related symptoms for the population? As in, does your patient data have limitations in how it can be interpreted, especially when comparing it to national studies on symptom rates?
Yes, I mean, there's always problems comparing studies to national averages. So the DHA Public Health has begun a series of epidemiologic studies in which they've identified a cohort population not exposed to the Navy drinking water system, but similar in all other fashions or as many things as they can control. That cohort is actually on Oahu, and they're looking at specific disease rates in each group, the control cohort and the residents of Joint Base Pearl Harbor, or the residents who were included in the Doors incident report initially. Those reports are ongoing, and as they come out, they'll be made available to the public.
Thank you. The next question may refer to the earlier discussion about the split sampling. My concern is the two data points are information, but not comparable towards coming to a conclusion. I don't know if anybody has a different interpretation of the intent of that question.
So the split sampling collected by EPA, we've just seen some data that was collected. The most recent event from earlier in June, that data is not yet available. The data that was collected by both the Navy and the DOH from February's DOH independent evaluation, that was shared in, or at least I highlighted rather, the summary findings of, both the Navy and the Department of Health found no petroleum based compounds in the drinking water. I know DOH's effort related to that is continuing, so I believe we'll hear more from them on that matter. And then, of course, we're going to be continuing sampling for the next year, so there will be additional sampling events with the EPA and more data to follow from those efforts.
Thank you. For the doctor, can you repeat the names of the models the EPA and DOH use related to exposure and symptoms, or provide it after this webinar?
The specific names of the models I will have to provide after the webinar, although the EPA or DOH would have that answer also since they're using those tools. Believe it's EPI, sorry, can't get the actual word in my mouth.
Well, I guess we can mark that one for follow-up unless somebody from EPA can chime in. Certainly outside of my area of expertise. Why not broad spectrum testing?
I'm going to assume that's a biomonitoring question. One of the, so there is a lab that does urinalysis for broad spectrum, I believe 178 metabolites. The most common reported positive is for MBTE, which is a unleaded fuel additive that was outlawed in 2003 and it does not exist in JP5 fuel or the current situation. The other problem with that type of testing is that the results that they report from this lab for the MBTE is actually a normal metabolite of the human body, and there's several conditions that can cause that metabolite to be elevated also. But specifically, the MBTE compound is being tested as part of every single one of those 9,000 samples that we've reported, and has not been detected in any of those drinking water samples. So I would consider that proof that if people are getting exposed, which is dubious, to the MBTE compound, they're not getting it as proven by samples from the water itself.
Yep. Next question. Even though the low-level TPH detections in the water system do not have a fuel chromatogram shape, isn't it reasonable that those low levels are hydrocarbon compounds that came from the degradation of the original fuel that entered the water system following the November 2021 spill?
Yeah, and I can jump in and answer that one. No, it's not. It's not. Because of the refinery process, when crude oil is manufactured, goes through refining into, the different distillates, gasoline, diesel phase, jet fuel, and heavy oils and lubricants. They have specific carbon ranges that are part of those. And so they have a very distinct profile, very unlike anything that would be natural or biogenic. And even as those degrade and break down, those profiles do change, but they maintain some of the original structure, and they are not indicative, or they don't match in any way of the biogenic profile. So it's very clear, typically when we look at chromatograms, whether or not we have a biogenic or naturally occurring hydrocarbon versus a fresh or even a weathered or broken down, we use the term weathered for breakdown, product of petroleum. So that's one of the things that we do as part of the visual indication or visual identification, and spend a lot of time and have a lot of discussions both with EPA and DOH on those in terms of the chromatographic analysis.
Next question. What would be the recommended diagnosis for pregnant mothers or babies exposed in utero or during the most critical developmental stages?
I honestly don't have a response for that. It's outside of the scope of my training, and but again, I would have to, that would be an individual patient, doctor relationship type response.
That would be, just to follow up on that, Captain, again, encourage anybody with that who is pregnant or is thinking of becoming pregnant to consult with their medical provider. I know that the Navy and the Defense Health Agency has worked hard to educate and make sure that medical providers are informed about the November 2021 release. And you should be able to get good informed information from them. If you're a pregnant mother or soon to become pregnant mother, definitely would encourage you to reach out.
Yep. Next question, how are you tracking the plumes from 2021 or previous spills?
Yeah, Matt, so environmental remediation, the groundwater monitoring and all of that, independent effort that's outside the scope of today's discussion on drinking water. But the Navy has efforts to collect data and evaluate and do some studies, surveys related to all of that. And we work closely with the EPA and DOH on those matters.
Thank you. The DOH sampling plan does not include quenching, and the Navy's does. Any comments?
So as I mentioned previously, there are a variety of different analytical methods that we use to analyze the drinking water samples. The standard drinking water methods, 524 I mentioned previously, which is for volatiles, that does have a quenching step. It's required as part of the sample collection. The 525, which is synthetic organic compounds, another drinking water method, requires quenching. Susan may be referring to in this question, EPA method 8015, which is a non-drinking water method. That we've had a lot of discussions about quenching versus not quenching. Originally, the decision under the emergency response and LTM was to not quench when we collected those samples. We've had a lot of discussions about that since January of this year. I believe we are all on the same page now that for 8015, the TPH method, that we are quenching. I mean, the Navy is certainly quenching the samples as part of the EDWM. I believe that may be an oversight, or they may not have included it, but they've been part of all those discussions and have been on board with quenching. And so I would be surprised if they are not quenching their 8015 samples that they collect as part of splits. So that may be a follow-on question with them for clarification, but that would be my understanding based on all the discussions that we've had with their technical team in conjunction with EPA.
Yep. Next question, with the outdated pipe systems, is the corrosion and buildup from previous spills being taken into account when it comes to exposure and potential exposures?
Yeah, so collectively, all of our sampling efforts through compliance monitoring, the previously LTM, now the EDWM, accounts for current distribution system, the state of the current distribution system, or rather the current state of the distribution system. But the known contaminant that these enhanced drinking water monitoring programs were based on were the known contaminant of concern of JP5, which stems back to the November 2021 incident where JP5 fuel at Red Hill made its way into the Red Hill shaft and then was distributed. We're not talking about other contaminants or spills that had occurred. That's not evaluated or included into our drinking water monitoring programs because we have no evidence of that.
Yep. Water users continue to report health issues with the drinking water. The Navy has not identified the contaminants causing the health issues. The BUMED requires the water system be taken offline until contaminants are identified and the system is restored to a safe condition. Why is the system still in operation? What actions are taken to notify people that the water may cause health effects?
So after the spill in November 2021, by the end of November, the Red Hill shaft was taken offline as a drinking water source for the Joint Base distribution system. So, and it was since physically isolated. So that well has not provided drinking water into the system for over 2.5 years. Yeah, sorry. Can you repeat the end of the question? Lost my train of thought.
Sorry, I just hit done. Give me a second. What actions are taken to notify people that the water may cause health effects?
So at that time, there was a advisory posted by the Department of Health, the Navy. And during that emergency response period, we collected a lot of samples. We developed a flushing plan where we systematically worked through the entire distribution system and flushed the entire system. Once we completed that, we received approval from the Department of Health, or actually certification that the water is safe to consume. Since that date, that's what the long-term monitoring program served to demonstrate, which the data we've collected does demonstrate the water continues to meet the state, federal standards, all applicable standards during that period and continues today. And so there is no advisory for the drinking water because it meets standards.
And just for reference, that acronym is Navy Bureau of Medicine and Surgery. Next question, is Navy considering the synergistic effects on human health of low TPH halogenated disinfection byproducts and lead detections?
So I think first and foremost, I mean, as we've mentioned, we've collected over 9,000 samples and have not seen significant numbers of lead detections. I believe we're somewhere in the order of 2022 exceedances of the action level. Overall, very low levels of lead detected, so it's not a system-wide issue, although we're still continuing to monitor it. Our halogenated disinfection byproducts, we've had no exceedances of MCLs for our total trihalomethanes or haloacetic acids. Those have been low and have been very consistent throughout. And as mentioned before, we've had no indication of jet fuel or other petroleum hydrocarbons in the system. Certainly, one of the things we're doing in terms of evaluating the data is considering all information that we have available, whether it's synergistic effects or other effects as we move forward.
Yeah. Why weren't you testing families admitted in the hospital or seeking medical care for all carcinogens the Navy was testing the water for when it was known early on what we were being exposed to? Why do you insist on taking on only talking about JP5 for medical testing.
So I briefly covered this in the previous response, but the drinking water monitoring programs that we have executed, so via the LTM and that extended drinking water monitoring, stems to the known contaminative concern dating from that November 2021 JP5 fuel release and contamination of the distribution system. Those programs are based on that known contaminant.
You. What changes, updates to the Joint Base Pearl Harbor public water system have been made after the 2022 EPA inspection?
So the inspection highlighted by EPA in their brief, that's the NEIC inspection from April 2022, identified some areas where the operations and maintenance of the water utility, that was what's highlighted here. Those discrepancies have been addressed through coordination, repair projects, improved procedures. Those are all documented through compliance with the administrative consent order, as I believe Chris highlighted during his brief. Those efforts continue today as the ACO is still in place.
Anything greater than these carcinogens we have been exposed to has been proven to cause harm and long-term harm. What is the Navy's stance on advocating for changing state and federal levels?
So both regulators set the standards that all water utility purveyors comply with. So we are, all of our measures are aligned to make sure our drinking water that we provide meets state and federal standards. I don't have anything further.
And then our last question, how are you able to reconcile low levels not meeting MCLs, yet your military families are seriously remaining sick to this date? Perhaps new MCLs or EALs are required to be health related rather than risk related. And I think that's sort of similar to that last question.
So I believe that question might be more so for EPA, but again, the drinking water that we sample and analyze, we do in compliance with whatever the standards set by the regulators are. However, the Navy is committed to do additional enhanced drinking water monitoring, and that's what the EDWM is for. We're going above and beyond to further analyze water quality at the Joint Base Pearl Harbor-Hickam system.
Right. That concludes the question and answer portion of the webinar, and concludes the webinar. The next webinar event will be announced soon. All webinar series information can be found at the link at the bottom of the screen, as you see on the screen now. On that page, you'll find webinar announcements and recordings for past events, and then this webinar should be posted there as well in the next couple weeks. Next slide, please. And thank you all for joining today, and I hope you have a great rest of your evening.